Hello and welcome to Talk to the Experts here on 770 CHQR. I'm Betty Jo Kaiser. Joining us today is Diamond Fernandes. He is the founder and director of the HeartFit Clinic, also author of Beating Hearts. That's correct, isn't it?
No, beating heart disease, yeah.
Beating heart disease. And of course, Diamond, you're the expert in this field. We've had you on before, and I'm very excited today because we're going to hear more about the HeartFit Clinic. We're going to hear something new about the HeartFit Clinic. And we also have another guest in studio, Greg McPherson. He's a client, a patient of yours. Greg, welcome.
Thank you. Thank you. Good to be here.
It's great to have you here. Before we move forward, for those of you out there listening, it's really important that we sum up what the HeartFit Clinic is all about. It's an amazing place here in the city of Calgary, really the only one of its kind in this part of the world. Mm-hmm. And you are in the business of assessing and preventing and treating heart disease.
Yeah, the big thing that we focus on is at the HeartFit Clinic is bridging the gap in our healthcare system. There are big gaps when we want to prevent heart disease or even prevent a second heart event, whatever it might be. And so for those people that are out there and they're listening and they have some questions about their heart, whether it be palpitations, irregular heartbeats, blockages, those are all, there's a whole bunch of things that encompass heart disease. And on a preventative level, we really focus on doing assessments that are not covered at our doctor's office. And so there's a big gaps, like I mentioned, when you go to your family doctor, and you want to know where your risk is of a heart attack, when we open up that toolbox of a family doctor, there's not much that they can do to see where your risk is of a heart attack or stroke. The reason why is because we plug that your scores into a heart score, and it gives us a kind of an idea of what's going on. But the problem with that is that the majority of people that end up in the hospital with cardiovascular disease actually have normal cholesterol. So it goes beyond cholesterol. And then if you, let's say your doctor's a little more proactive and they might send you to even the best cardiologists in the city and they say, you know what, I got this really great cardiologist. The concern with that is they're only looking for advanced stages of disease. And so I always like to say that your arteries are a muscle, they're not a pipe. And so we have to take our thinking that our arteries close up like the kitchen sink pipes do, So people think that, okay, well, I got cholesterol that sticks to the pipes of and it accumulates and it gets to 90%. And if that last 10% closes up, I have a heart attack. And that's furthest from the truth. And so when you go see a cardiologist, they're looking for advanced stages of disease like that 90% blockage or more. If you are not there, then you just get dismissed, unfortunately. It's just that, okay, well, it's not bad enough. There's nothing I can see, so don't worry about it. And so many people get the exercise stress test, and the concern with that is it only shows blockages that are really advanced. And so at the HeartFit Clinic, we do tests to see where your risk is of a heart attack or stroke before that happens. And the reason for that is the majority of heart attacks and strokes occur with blockages that are less than 50%. And that sounds odd to people. I mean, it sounds different. And at the HeartFit Clinic, what we really focus on is assessing to see where your risk is before it starts to show up as a problem. I mean, for whatever reason that might be, I have 3 young kids and, I want to be around for them, right? And so it's important to kind of see, well, where is my risk? And more importantly, we can reverse that disease risk.
Right. Yeah. And that's one of the things that really sets the HeartFit Clinic above, number one, that assessment, but then being able to treat.
Yeah.
And we will really get into that later, but I want to touch on it now because you can't get this treatment anywhere except at your clinic. And that, of course, is ECP.
Yeah, the external counterpulsation treatment that we do in our clinic. We're opening up a clinic in Edmonton here, and so it's going to be exciting to be really what we focus on at the HeartFit Clinic is focusing on things that we can reverse a disease process. And so, Greg will talk about his story in a bit, but the external counterpulsation therapy is one of our biggest things where it's non-invasive, it's safe, there's no radiation. It's a great treatment to basically grow new arteries, improve heart function and artery function. And so when we combine that with our exercise programs, with our education, nutrition, stress management, supplements, all that comes into play to how people reverse a heart disease process.
So I find it interesting because it's not a regular treatment here, and I've learned a lot about it. It makes so much sense to me, and I'm delighted that you've brought in someone that you have been working with, a client, a patient, Greg. The first question I said is, Greg, how did you hear about this HeartFit Clinic? How did you hear about this ECP? And I was astounded at your response. So first of all, welcome, and tell us a little bit about how you heard about this.
Well, absolutely, Betty Jo. Well, I got to tell you, I was doing some business in Asia, and a friend of mine had mentioned, counterpulsation. And I was in Asia as an individual, working the best I could. But I was kind of moping around, and I wasn't in very good shape. I'd been suffering from a heart attack that I had in 2011. I had my 911, Betty Jo, on February 14th. Can you imagine? At 3 o'clock in the morning, when I woke up in a pool of sweat. Oh. And I felt, man, I've got this severe indigestion. And so the first thing I do is I get up and I'm feeling kind of woozy, but I'm going for the Tums. That was my first inclination, to go for the Tums. And so I went for the Tums. I took 3 Tums, and I went out to the living room, and I've got a long hallway in my bedroom, so it's quite a hike to get down there. And but I made it to the living room and to the kitchen and got the Tums, and I thought, these Tums, after taking them, 2-3 minutes later, aren't doing anything. In fact, the pain that I was experiencing, or the discomfort, was starting to ramp up. So I felt this pain coming on, and I thought, you know what? Maybe I'm having a heart attack. Yeah. It came down to thinking that's what was going on. So what do? The first thing I do is I put myself into a yoga position where I just open up my chest cavity and, try and help things out. And I did that, and I kind of hung myself off the side of the couch and to get some relief. And I was finding no relief. It was getting worse and worse and worse. And in fact, now I'm starting to feel the weakness that comes along with having a heart attack. Obviously, that was my first heart attack. It was a massive heart attack that I found out later on that I was having. But all of a sudden, I felt weak, and the pain was increasing. And so I'm thinking to myself,
dial 911.
Yeah, you know what? I didn't go there yet.
Really?
But I ran to the cupboard.
Yeah.
And I grabbed the aspirin.
That's good, yeah.
And I put a handful of aspirins because I could barely open the container at that time. So I put a handful of aspirins in my hand, and I throw them in my mouth, and I started chewing these down. And I did that, and the pain was increasing, and I was starting to fade away. I just kind of felt like I was fading away. And so the thing that I thought in my mind is I'm going to take my last breath. It's kind of like the old martial art thing that we learned back, when we were training martial arts. We call it the iron shirt. You take your last breath in, you breathe in deep, and then you drop your energy low. And I started my way back to the bedroom. I was thinking, I've got to wake my wife up, who was still sleeping. And, how am I going to do that? Because I'm feeling weak, okay? I don't know if I'm actually going to make it back to the bedroom. And so I'm going down that long hall that I mentioned at the beginning, and to the bedroom, to the master bedroom. And I started banging off the wall. Because
you were out of balance.
I was off balance, and I didn't have the strength. Remember, I'm breathing out now because I took that last breath, thinking that I'm not going to make it. I was at that point. But I'm going down the hallway. I start banging off the sides of the wall, and I made it to the bathroom, and all I remember is thinking, this is it. And I fell to the ground, and the next thing I remember is the paramedics. They brought me back, and I'm looking the paramedics in the eyes, and I can't say anything, and I've got my cat. We had a lovely cat. He's sitting right on my head.
Yeah.
This cat's, he's trying to help me out. He says, this guy needs help. Well, what great service. I can't say enough about, our incredible 911 operators. Obviously, my wife had called 911, and they were there, and I was all hooked up, and that was my point of coming to. And they were assessing me. They were in contact with somebody from the cardio ward at the Foothills Hospital. I was living out in the country in the Strathmore area, and they then proceeded to get permission to move me because they were treating me and stabilizing me and doing what they do best.
Okay, I'm going to interrupt you, Greg,
Okay.
because this story, I'm on the edge of my seat, but we are needing to take a break. Diamond, you've said it countless times.
Yeah.
And if you have a heart event and it's emergent, we are in the best place in the country.
We got some of the best cardiologists here in the city to deal with that emergency situation when
When
that
it's
happens.
emergent, you dial 911.
Absolutely.
So thank you for the first part of your story, Greg. We're going to hear a little bit more, and we're going to hear how you came around to understanding how you can prevent further problems with your heart, and I'm excited to hear that. But we have to take a break. Hello and welcome back to Talk to the Experts here on 770 CHQR. I'm Betty Jo Kaiser. Joining us today is Diamond Fernandes. He's the founder and director of the Heart Fit Clinic here in Calgary, also author of Beating Heart Disease. And they can be reached at heartfit.ca. The phone number is 403-870-4348. Thanks for joining us, Diamond, and congratulations. You have a clinic opening up in Edmonton.
Thank you. Yes, it's very exciting to help the people in Edmonton prevent and reverse heart disease too. So
That's awesome. That's great. On the grow. Joining us today as well is Greg McPherson. He is a patient, a client, goes to the Heart Fit Clinic all of the time. Diamond brought him in because Greg is able to share his story with us. And just before the break, we heard about the details of your heart attack. And I was on the edge of my seat. Honestly, thankfully, your wife called 911. You got yourself to the hospital, and treatment began for the emergent heart attack, correct?
Yeah, absolutely, Betty Jo. The best service. I mean, if I can say, Calgary Foothills Hospital, number one cardio. So if you're having a heart attack, you want to be at the Foothills Hospital. Once they got me to the hospital, 5 minutes later, I'm on the operating table. And they opened up. They basically put a stent into one of the arteries that was blocked. Yeah. And but I got to tell you, the pain up until that point, and I mean, they can put morphine in you, they can do whatever, but the pain of that ischemia, an ischemic pain is what it is. You can't subside that. Mm-hmm. I felt nothing with the morphine. All I felt is this massive pain. And when I got into the operating room, they were efficient, they were fast, they opened up that artery, they put in a metal stent, and they basically saved my life. Right. And so I've got nothing but great things to say.
And that's important to do, especially if you're having a heart attack. A heart stent is you want to get that in as quick as possible. So,
So then you followed up with a cardiologist that gave you some instructions to carry on after this?
Yeah, absolutely. Obviously this was a massive heart attack, and there was heart damage, and so I was in rehab, and I did everything that I was supposed to do. And when I was first diagnosed after the heart attack, I had 2 or 3 blockages, and just like our heart disease or atherosclerosis is, it's heart disease, and I started developing more blockages. Now I'm up to the point between 10 and 20 blockages.
Wow.
And so I progressively, instead of, getting better and better, I progressively started getting worse and worse, and I was dysfunctional.
Yeah, and heart disease is a progressive disease, right? And so a heart stent, it's very important to get if you're having that heart attack, right? But the concern is that heart disease is a progressive disease. It likes to get worse. And at the Heart Fit Clinic, our focus is to obviously prevent that progression or even reverse that progression of heart disease. So, yeah.
So how did you hear about the Heart Fit Clinic?
Yeah, so let's get to that. I was on business in Asia, found out about these counterpulsation machines, and so I did some more research, and I found out that they're huge in Asia, huge in India, and as a matter of fact, they're fairly huge in the United States. They're FDA approved.
And Diamond, you've said this all along. This is frontline care in a lot of places in the world.
Absolutely, and in my opinion, it's one of the fundamental treatments of doing if you have coronary artery disease, heart failure, or poor circulation, right? It's really one of the best treatments out there to help out with that part of it, especially if you have heart disease. I mean, our focus at our clinic is just on heart disease. That's it. We don't do anything else. You know, if you got any other ailment or concern, so we know well, and this is what we love to do. And so we're always staying up to date on current literature and helping patients prevent and reverse heart disease.
You're listening to Talk to the Experts on 770 CHQR. I'm Betty Jo Kaiser. Diamond Fernandes, the founder and director of the Heart Fit Clinic, joins us today. Oh, by the way, if you are in a rush and you want to get more information, it's heartfit.ca, or you can call them at 403-870-4348. Outside of the calling area, 877-700-4348. Greg McPherson, who suffered a heart attack, had stents put in, carried on with his life, though he was unwell, and was in Asia and heard about this ECP, External Counterpulsation Therapy.
Yeah.
And you were were you a little astounded that this is not something that we have as readily available as it is in other parts of the world?
Well, I got to tell you, Betty Jo, I was absolutely shocked because I'm one of the guys that if you told me to do this or that, and that it's going to help me with my blood flow in my heart and help me feel better, help me get back to, feeling like a human being, I would have done it. But nobody told me that, and I was asking. I asked my GP, I asked specialists, I asked everybody I came across. Mm-hmm. And but when I found that out in Asia and I got back to Calgary, right away I looked up and found the Heart Fit Clinic and realized, okay, this is where they've got the ECP treatment. And in fact, it's the only place in Calgary, maybe in Alberta.
Yeah. As far as we know, right?
Yeah.
Soon in Edmonton.
Yeah.
And so you went in, and did you get the whole, and Diamond, please jump in on this as well, did you get the whole deep assessment? Like he'd already had his treatment.
So we do a lot of preventative screenings too. So Greg went through quite a bit of stuff as well. But what we focus on, we know he has coronary artery disease. So we didn't do that test where just see where his risk is. It's called a protein unstable lesion signature test. And that's one of our big fundamental tests that we do to see where your risk is of a heart attack or stroke. Now, we didn't do that test on Greg, but
because you already knew.
I know he has heart disease. And so the big thing that we focus on with Greg is let's get the ECP treatment, the external counterpulsation, and get him assessed and see what's doing. So the other test that we do is because earlier in the show I talked about how the majority of heart attacks and strokes occur with blockages that are less than 50%. That's the pulse test. That's the test where we can see where that risk is of a heart attack or stroke in the next 5 years. Because the whole goal is Greg is actually quite fortunate. He's quite fortunate to be sitting here and talking to us, because if he had waited any longer, it probably wouldn't have been good for him. So,
exactly.
And unfortunately, a lot of people think they're invincible. I exercise, I eat well, and the fact is that it goes beyond that now. Heart disease is an inflammatory disease, and it can happen to anybody. It doesn't have to be someone who's overweight and smoking and diabetic. It doesn't work that way anymore. And so, all those are important risk factors to take care of. Many people wait until it's too late. And so we want to prevent that. We want to, just like you get insurance for your house, your car, or on yourself, we want to make sure that you're around for loved ones, and that's important. So we have these tests to see for the artery health. We're able to see what the health of the artery is. We're able to, because the arteries are a muscle, right? They're not a pipe. We have tests to see the artery function. We did those tests on Greg. And then the blood work that we do is the a particle size test. I talk about that, where if you go to your doctor's office, they just check your cholesterol, right? And so what we do is we break that down a little bit more carefully, because I talked early in the show that the majority of people that do have heart disease, heart attacks and strokes, cardiovascular disease, they actually have normal cholesterol profiles. So it goes beyond that. And what we do is we go beyond that. So the artery is protected by a tennis net-like structure. And so you have tennis ball-sized particles and you have golf ball-sized particles. The tennis balls won't go through a tennis net, but the golf balls will. So we measure those golf balls, and we look at some other key blood works to kind of look at things a lot more carefully when it comes to heart disease. So when we saw Greg, our big focus is to get him to do our our exercise, our ECP therapy, our education process so that he can reverse the disease process.
How long ago did you go to the HeartFit Clinic?
Well, I just finished my last treatment there about six weeks ago.
Yeah, recent. Yeah.
So it was pretty recent that you went. And how are you feeling?
Well, I got to tell you, Betty Jo, this is the best I felt in 9 years.
Wow.
And it's given me a new life. I'm back at the gym an hour and a half a day.
Wow.
And I've got the energy. The side effects, are that you got blood flow.
Yeah.
And I think my eyesight got better. I think my hearing got a little bit better. And I'm definitely, seeing more hair. Okay, so I'm giving you benefits, right? Because I said to myself, what other things has it done for me?
That's something.
Well, yeah, and when you increase blood flow, so many good things happen, right?
Right.
And so obviously our big focus is we're not a hair loss clinic or anything like that, but the idea is that we're a heart clinic. And when you increase that amount of blood flow to the heart muscle itself, you see great things happening. We see improvements in echocardiograms. We see improvements in exercise capacity. We see improvements in artery function. That all happened with Greg. We measure it.
That is awesome.
We measure the changes that happen when people do our assessments. And so it's fun. It's a lot of fun. And Greg's one of many. We had an open house here the other night, and Greg got to meet, you do get to meet people that are on and off the bed, before your times, and we have a couple beds that going. But, Greg got to meet a lot of people that have done the treatment and at the open house or even in currents in treatment. And, I don't know, you probably can talk to some of that stuff, the conversations you had there too. So
we need to take a break. You're listening to Talk to the Experts here on 770 CHQR. I'm Betty Jo Kaiser. Diamond Fernandes, the founder and director of the HeartFit Clinic, is joining us. And he is also the author of Beating Heart Disease. Welcome back to Talk to the Experts here on 770 CHQR. I'm Betty Jo Kaiser. Diamond Fernandes is the founder and director of the HeartFit Clinic here in Calgary and soon to be in Edmonton as well.
Yeah, it's exciting. Yeah.
Very exciting. In September?
In September, yeah. Probably in the fall here. So
great.
Yeah.
Diamond has also authored a book, Beating Heart Disease, which can be found on their website or on Amazon. The website is heartfit.ca. Tons of great information on there. And you can also give them a call and get your appointment booked, 403-870-4348. That's 403-870-4348. And out of the calling area, it's 877-700-4348. Joining us as well today is Greg McPherson. Greg has had a first-hand experience. He has suffered a heart attack. He has gone through the experience of emergent care here in Calgary, and you have said what we all pretty much know to be true. If you're going to have a heart attack, good for you to be in Calgary because we have the best of the best here at the Foothills. Mm-hmm. And so you had that emergent care, stents put in, and 8 years later, though, the disease was progressing and you were still not feeling well. You went overseas to Asia, and there you discovered a treatment that you hadn't heard of. Yeah,
absolutely, Betty Jo. And when I got back to Calgary, I got a hold of the HeartFit Clinic, and within a week, I had an appointment. And within another week, I was on the bed. I was on the ECP bed.
Wow.
And
so tell me about the appointment that you had. How long did it take and what all did they do? Because there was some testing that still had to be done.
Well, absolutely. They do testing, and they also make sure that you're going to be able to take the treatment. So and you could speak to that.
Yeah. So everyone that comes into our clinic, we need to make sure it's safe and effective for them to do that. So we might order some diagnostic tests, which we did, and get all set up. So usually I'm the first person that you might meet to explain a little bit about our processes, and then after that, Greg knows that we have some great staff to kind of take care of the rest of that. So you can talk about maybe the assessment that we went through as well, and then.
Yeah. How long did the assessment take?
Well, the assessment took about 45 minutes to an hour.
Yeah, I think it was close to a couple hours we did with you, but that's okay.
Right.
Yeah.
Well,
time flies at the HeartFit Clinic. Time flies when you're having fun.
Absolutely, yeah.
Absolutely.
So did you get on a? Did you have to do like an exercise test?
Yeah, absolutely. I did, and from there they can see how bad I actually was, and so they give you a point. You're at point A, and you're going to need treatment, Greg. And so I started taking the treatment, and it's kind of like having an extra heart working for you. It's counterpulsation. Every time my heart relaxed, I had this beating heart.
Yeah, from the bottom of your legs. Yeah,
from the bottom of my legs.
Okay, so the assessment included some exercise tests, some blood work, pretty non-invasive, standard type, like a typical getting some tests done.
Yeah.
Only there for under a couple hours. And then you were back the following week.
That's right.
For the ECP.
That's right.
The External Counterpulsation Therapy.
That's right.
So now tell us about that experience. You lay down on a bed.
Yeah, well, it's a unique looking contraption because it looks like a blood pressure machine, but it's being attached to your ankles and your legs, and it rolls right up, your legs and goes on into right up to your midsection. It's around your buttocks, and then that starts to beat. It's kind of like when my uncle told me this is how we milk a cow. There's a way to milk the cow.
Right.
Well, this is kind of like pushing your blood up from your ankles, just like you're milking a cow. It's pushing that blood.
How does it feel?
Well, I was a little bit concerned because I hadn't been on it. But after you get on it and you feel it, takes about 10 minutes to get used to it. But it feels like you're getting squeezed.
Okay.
And but after you get used to it, it's a very comforting feeling, and it's almost like you're getting a heart massage.
Really?
Oh yeah.
That's cool.
Yeah.
And how long do you lie there for?
It's an hour treatment.
Mm-hmm. And I know it varies from person to person. How many treatments did you have?
Okay. They have a program that at 35 treatments, you're getting the full grommet. Yeah. But in my case, because it was such a hard case, Diamond, decided you better get some more. So I think I had 52 treatments, Diamond.
We did 50 treatments,
And how often? Once a week?
Yeah, once a week. We became our best friends for about a couple months there, and actually 2-3 months there. And he finished, I guess, in the spring here, and then we had it's really good. It's nice to see what's able to happen with Greg, and that's what really fuels our passion as to what we do. And
seeing when we see results,
when we see results with people, and I'll be honest with you, and I don't mean to sound like it's there for everybody, and I'm like, okay, well, come on this bed and you're going to experience things. I'm like, every time someone comes on the bed, I'm a little bit, okay, yes, the research shows it's of benefit, and Greg probably did his research. I know he did his research when he came to see us, because I know he already wanted to do the treatment. But every time someone comes on the bed, I'm like, I really hope this works for you. Obviously, we're going to do our best to make sure it does, but everybody that comes off the bed has benefits.
Yes.
And I'm just like, okay. I kind of downplay it, I should say, but even with Greg, it was really nice to see, because he's got multiple blockages. I know we mentioned that earlier, and so it's nice for him to be able to do things. He's a busy guy, he's a business guy, and so it's important to kind of do that part.
You're listening to Talk to the Experts on 770 CHQR. Diamond Fernandes is joining us. He is the founder and director of the HeartFit Clinic. Find out more at heartfit.ca or call 403-870-4348. So I have to ask, you said that he had blockages, the disease was progressing. After he had the ECP treatments, were you then able to see where those blockages are at? Like, can you go back and take a look at that?
And the common misconception now is that people think that, okay, well, I want to get another angiogram and see what these blockages are doing. And so you never really want to do that. Those tests are meant for an emergency situation, what Greg went through when he had his heart attack. I talk a lot about, even in past shows, about how we navigate heart disease. And I'm really against getting an angiogram done on a preventative basis, or an elective basis, I call it. And so the common thing is that sometimes, and Greg can talk a little bit more about this, but if you saw your family doctor and you said, look, I'm not feeling good, let's get another stress test, and the stress test would show bad, and then you get a nuclear stress test, which is, I'm not a big fan of that either, because you already know that someone's got heart disease. So really the best treatment option, and based on, for our listeners, you can listen to the Courage trial, or the Orbita trial, or the Decision CTO trials. Those are big trials to support what I'm talking about, when I say these statements is that the angiogram should be reserved for those patients who have unstable or are actually having a heart attack.
Right.
It's an invasive test. I mean, Greg went through it. They throw in a catheter through your arteries. Your arteries are a muscle, right? They're not a pipe. And so they want to get in there as quick as possible and open up that artery so you can feel better. If you're coming in and you're saying, okay, well, I have chest pain still and I got these blockages, the cure now is not always to do a stent. You know, not that you want to wait till it gets bad. You want to be able to do ECP therapy and lifestyle education that we give at the Heart Fit Clinic to reverse the disease process.
You are listening to Talk to the Experts on 770 CHQR. We do have a little bit more. We're here until the top of the hour. Diamond Fernandes is the founder and director of the Heart Fit Clinic. You need to check out his book. He's the author of Beating Heart Disease, and you can find it on Amazon and other usual places you find books, or just go to the website, heartfit.ca. Tons of great information there. Call them at 403-870-4348 or long distance at 1-877-700-4348. Diamond and his client, Greg McPherson, will be back with me after this, and we will learn a little bit more. Be back shortly. Hi, and welcome back again to Talk to the Experts. I'm Betty Jo Kaiser, and we have Diamond Fernandes joining us today. He is the founder and director of the Heart Fit Clinic and the author of Beating Heart Disease. You can find out all about the Heart Fit Clinic and get a copy of that book at heartfit.ca. They are reachable at 403-870-4348. Long distance, 1-877-700-4348. And Diamond, you're opening up a clinic in Edmonton. In September.
Absolutely. It's exciting.
That's very exciting. Congratulations on that. And stay tuned for more info on that. Joining us today is Greg McPherson. He is a patient at the Heart Fit Clinic, and it has been awesome hearing your story. I'm sorry that you suffered a heart attack and that you have heart disease, but your story and how the Heart Fit Clinic has helped you reach this place in your life is super inspiring, and it's awesome.
No, absolutely, Betty Jo. It has been inspiring. Before I got in the clinic, I couldn't even walk up the stairs.
Is that right,
to the clinic. And
like you'd have to stop partway?
Oh, yeah.
Well, we're on the second floor there. The Heart Fit Clinic's on the second floor, so yeah.
No elevator.
There is an elevator, absolutely.
Yeah.
But you were taking the stairs because you knew you needed your exercise.
Well, I was doing the best I can, right?
Right. And so you were struggling making it up the stairs.
Put it this way, by the time I get to the top of the stairs, I'm winded. And by the way, I was, at that point, I was still taking 8 shots of nitro a day.
Wow.
Yeah, to subside the angina pains I was getting. And
Really?
Oh, yeah.
So Greg would probably have been referred at this point to getting bypass surgery.
That's right.
Because of the multiple blockages.
Okay,
right?
that would be sort of the next traditional step.
Yeah, and so... And bypass surgery, while it would have subsided his pains, probably, I should say, but it is an invasive procedure, right? And the whole goal at the Heart Fit Clinic is you can always do surgery later. You know, it's not that it wasn't emergent per se with Greg and with many people that are waiting for bypass surgery. It's not emergent, and many times people have to wait 6 months to a year to get the bypass surgery, right? And so my point is that you can always do surgery later. You can cut me open another time, but Greg decided to do the ECP therapy and see if that works first, right? So,
yeah.
And so when you got in, like, tell us again a little bit about it. So you go in there, and it's like a dark room, a light room. Yeah,
well, they've got a couple of rooms there. One with the TV, so if you like watching movies, because you're there for an hour, right?
Right.
And I was coming in 5-6 times a week, and so an hour every treatment.
Yeah.
So what's nice to have the TV there, but they have a nice room there that's bright, and I'm actually looking out at trees and things that are going on outside. So that's where I chose to be. And so you lay down in the bed. They hook up this second heart contraption, and it all of a sudden starts working. And the staff there, Sarah and Deb, and these are
those are nurses. Yeah,
these are nurses. Yeah. And it was an education process too, because I'm there for an hour. So you strike up a lot of conversation, and you really start to learn, how you can really progress your treatments and get better and better. And you start to learn how it works and why it works and the things that you should be feeling, as it progresses. And so it was really an education for me.
Yeah, you honestly, I have to say, you look the picture of health. It is hard to imagine this gentleman going up a flight of stairs and feeling like winded.
Yeah.
Hey? And it must be very gratifying for yourself and your staff.
Absolutely.
Diamond.
I mean, it almost brings tears to my eyes to some of the things that we do to patients. When we see patients, like just recently, I'm not sure if you met him, but we had a patient who was in the hospital with heart failure, and they couldn't even walk up 1 or 2 steps to get off of the parking lot. They parked at a different part of the parking lot. They couldn't walk up like 3 or 4 steps. They had that much problem. Wow. And obviously we have an elevator, so they took the elevator. They would have to stop a couple times just walking into our clinic. And now, no problems. Wow. No problems at all. I mean, I know we can test this, but he had an ejection fraction of 10%, and now it's like in the mid-20s and climbing as we speak. And so many people give up hope in terms of where they are with their heart health. And so if you've had a heart stent or had a bypass surgery, and these are not cures, that's important to say. Heart disease is a progressive disease. And what we like to do at the HeartFit Clinic is reverse that disease process.
And knowing that you can that is
that's the fun part.
The wow.
And there are thousands, hundreds of thousands of people out there that have heart disease or know someone has had it and think that they're okay. And really the big thing you want to avoid is heart failure.
So let's just go through the people that would benefit from this.
Yeah.
So of course, somebody that has already experienced a heart attack and has progressive heart disease, which is Greg's case. People that suffer from angina.
Yeah, angina pain. So coronary artery disease, any type of coronary artery disease is important. Microvascular disease, what we call coronary syndrome X, and if the vessels aren't working like they're supposed to, that's what we do at the HeartFit Clinic, is make sure that they're working better. And so that when you improve blood flow, it's such a great treatment for diabetics.
Right.
Great treatment for poor circulation. We turn our head and when we talk about sexual dysfunction or erectile dysfunction.
We're not going to blush because this is a huge benefit.
It irritates me a little bit, unfortunately, especially for those doctors that don't know about our clinic. We get a lot of referrals from our physicians and cardiologists that know about what we do and how we benefit the patients. But it bugs me when it's being masked with a pill, right?
Yeah.
And so that's actually a big marker for coronary artery disease, because your arteries going to your sexual organs are a lot smaller than the ones going to your heart. And so sometimes one of the first symptoms people feel.
Interesting.
Yeah.
And
that's where, sorry to interrupt, but that's where our heart assessments are very important to see, okay, well, let's look at your cardiovascular disease risk. And if it is at risk, let's reverse that.
Yeah. So there's lots of, the HeartFit Clinic is not just for somebody like Greg who's had a heart attack and doesn't want to have another one.
Exactly.
There's a wide range of people. And you, in fact, have had people that are very athletic and very active. All kinds of people are checking out the clinic because they're concerned about maybe even family history.
Family history of heart disease. People who just want to know where their cardiovascular disease risk is. We do tests that are just not available at your doctor's office. And we bridge an important gap in our healthcare system. Why? Because the majority of heart attacks and strokes occur with blockages that are less than 50%. And if they're greater than that, you start to feel angina pains, which is what Greg was feeling, right? And so, and that's where ECP therapy would be a treatment option. But we want to know before it starts to be a big concern.
Right.
Yeah.
Greg, if you can, this might be tough. I'm going to choke up now. How do you say thank you to these people? Like clearly you've got to have a feeling like you've helped save my life.
Yeah, well, absolutely. This has been a lifesaver for me. And so, how do I say thank you? I just tell as many people as I possibly can. And, my friends say to me, what the heck happened to you? Because I had old man syndrome where you start walking like an old man. I'm only 53 years old, but I was walking like I was 73. And now I've got a spring in my step again. I'm back in that gym, like I said before, Betty Joe, for an hour and a half a day. And so people see the results, and I can just tell them about it and refer them to Diamond. That's what I'm doing.
Diamond Fernandes. He is the founder and director of the HeartFit Clinic. You can reach him by checking out their website, heartfit.ca, or call 403-870-4348. As Greg said, it's pretty quick. You're in within a week or so. If you are out of the calling area, 877-700-4348. That's 877-700-4348. Also, Diamond is the author of Beating Heart Disease. You can pick up a copy of that book. Congratulations again on the opening of your clinic in Edmonton.
Yeah.
That's super exciting.
It is exciting.
And Greg, thank you for sharing your story today. It's definitely given us a different perspective on this very unique clinic, only place in this part of the world where you can get this type of treatment. So if you're one of those folks out there that wants to know or has experienced heart problems, by all means, give you guys a call, correct?
Yes, absolutely. And we look forward to, we do consultations with everyone to kind of see if this is a good fit and how we can help people. You know, if you have high blood pressure, diabetes, just want to know where your risk is. Pills can take you only so far. We like to reverse that process.
Heartfit.ca. Thanks again for joining us on Talk to the Experts. I'm Betty Jo Kaiser. This is 770 CHQR.